President Trump is expected to sign a $9 billion rescission bill into law, cutting funding for several programs.
PEPFAR, the global arm of HIV/AIDS response, was originally included but was saved. 9 News' Grant Johnson spoke to a CU professor about how the earlier funding freeze impacted her work in Kenya.
A home office can say a lot about someone's journey.
This is just sort of like decorative from Kenya.
Dr. Lisa Abwogi's is filled with reminders of her 2 decades of work in Kenya.
So when I went to Kenya in 2007, I went to a rural place and worked in a rural hospital. In the wards, there were people 2 to a bed and under the beds on the floor, dying of HIV. Adults and children and babies. When I go to Kenya now, the wards are quiet.
Progress on the HIV epidemic in Kenya is now in jeopardy. Dr. Abwogi has worked on projects funded by PEPFAR, the President's Emergency Plan for AIDS Relief, since just after its creation in 2003. In January, the Trump administration froze funding for the program, putting an immediate stop to her work.
So I was in Kenya. I was visiting with my colleagues who implement PEPFAR programs, and it was awful. I was so ashamed to be in clinics as an American and someone who had supported HIV treatment and prevention, and to see the clinics ghostly quiet.
Her colleagues in Kenya left without jobs, but still came to work. Dr. Patrick Oyaro is one of Dr. Abwogi's research partners in Kenya.
When the stop work order was instituted, it meant that the support that they were getting could no longer continue. Very critical is the medication. It can lead to increased mortality, and it can also lead to increased infection.
Dr. Abwogi says the work in Kenya doesn't just help the people there, it helps Americans too.
HIV and other infections across the world and other global health issues affect us all. It affects our global security, our economic security. So when people are dying of illnesses or poverty or other things, then the global economy doesn't work in the way that supports Americans.
For now, Dr. Abwogi doesn't know when she'll return to Kenya.
I used to be able to go 2 to 3 times a year. I don't know when I'll go next.
But when it does happen, she'll likely return with more memories from her time with those she's touched. In Denver, Grant Johnson, 9 News.
Dr. Abwogi says that she has received the bill passed without cuts to PEPFAR and hopes the administration won't try to weaken the program through other means. The bill just waits for the president's signature to make it law.